Welcome. Let us discuss about the hormonal control of lactation. Lactation. Lactation is the process of milk secretion from the mammary glands of a mother soon after childbirth. Alveoli of the mammary glands will produce milk that is secreted into the mammary ducts which opens at the nipple. Lactogenesis. The process of developing the ability to secrete milk and involves the maturation of alveolar cells. Lactogenic hormones. The hormones which stimulate the growth of mammary glands and lactation after parturition. From the 6th month, that is 24th week of pregnancy, the woman's body produces hormones that stimulate the growth of milk duct system in the breast. There are 4 major hormones that help the breast to make milk. They are estrogen, progesterone, prolactin, and oxytocin. Estrogen hormone. It is secreted by placenta and ovary. This hormone helps in increasing the size of the breast during pregnancy, causing the ductal system of the breast to grow and branch. When the placenta is discharged after birth, the levels of estrogen decreases. This decrease signals mother's body and triggers the onset of copious milk production. Increased level of estrogen inhibits lactation. Progesterone hormone. It is secreted by placenta and ovary. This hormone is required for the final development of the breast into milk secreting organs. Once the ductal system has developed, this hormone causes an additional growth of breast lobules. When the placenta is discharged after birth, the levels of progesterone decreases. This decrease signals mother's body and triggers the onset of copious milk production. Increased level of progesterone inhibits lactation. Prolactin hormone. It is a protein hormone responsible for milk production. When the baby breastfeeds, there is a transmission of nerve signals by sensory nerves to hypothalamus in the brain. From there, the signals are conveyed to the anterior pituitary gland where they induce the prolactin release, and then the prolactin acts on the alveolar epithelium to promote the secretion of milk. The prolactin levels are higher at night. The prolactin levels are higher until 2 months of postpartum. Women who smoke have low prolactin levels. Oxytocin hormone. It is a protein hormone responsible for milk ejection. It is also called as let-down reflex or milk ejection reflex. When the baby breastfeeds, there is a transmission of nerve signals by sensory nerves to the hypothalamus in the brain. From there, the signals are conveyed to the posterior pituitary gland, where they induce the oxytocin release into the bloodstream. Then, oxytocin is carried to the mammary gland, where it produces contraction of myoepithelium surrounding the alveoli, thus expelling the milk into the duct. Even though the alveoli may be full of milk, the milk cannot be released without oxytocin. Within 30 seconds to a minute, after a baby begins to suckle the breast, the milk begins to flow. The release continues until the baby stops feeding and will restart when the baby feeds again. Low levels of oxytocin prevents milk ejection. During pregnancy, the breast enlarge greatly. Further, there is a development of duct and appearance of many alveoli which forms lobules. No milk is secreted by the gland at this stage. By the end of pregnancy, the mother's breasts are fully developed. The fluid secreted during the first 3 days after parturition is called colostrum. It is yellow in color, has high protein, low fat, and sugar content. The milk formed during the first few weeks is called intermediate milk or transitional milk. Mature milk appears at the end of first month. The following can adversely affect the breast stimulation and milk production. Maternal factors: stress or anxiety, separation of mother and child, hormonal imbalance, new pregnancy, insufficient breast tissues, tube-shaped breast, surgery to the breast or nipple, breast injury, bad breastfeeding position, poor nutrition of the mother, alcohol consumption, smoking and having drugs, high caffeine consumption, a history of radiation therapy. Infant factors: using commercial instant formula and a baby bottle, longer periods between feedings, baby does not wake up at night, baby sleeping for longer periods or that does not wake up, jaundice, prematurity, certain medications. Short tongue frenulum, baby refusing the breast, rapid flow, flat nipple, large nipple, weak suction, premature baby, sick baby. Important nutrients during the lactation: energy, protein, vitamin A, iron, folic acid, iodine, calcium, zinc, vitamin B12, and choline. The food you eat should be packed with nutrients, not empty calories. Eat fruits, vegetables, whole grains, proteins, healthy oils, and fats and water. Advantages of breastfeeding. Benefits for baby: it promotes a close bond between the mother and child. Breast milk contains antibodies that help your baby fight off viruses and bacteria. Breastfed babies have lower incidence of diarrhea, ear and respiratory infections, less likely to become obese, reduces the risk of sudden infant death syndrome, decreases the risk of childhood leukemia, decreased risk of having asthma or allergies, and hospital admissions compared to the bottle-fed babies. Benefits for mother. Breastfeeding burns extra calories, so it can help you to lose pregnancy weight faster. It lowers your risk of breast and ovarian cancer and osteoporosis. The uterus returns to its pre-pregnancy size and reduces uterine bleeding after birth.